Hey, I'm Jennifer, and I'm going to be validating the medication administration with injections. So the first thing I'm going to do is check the physician's orders, and then I'm going to check against the MAR and make sure that the MAR and the physician's orders are correct. I'm going to check the medication by the vial to the physician's orders and make sure that it matches, and I'm going to do this 3 times. Then I'm going to wash my hands, do really good hand hygiene, and apply my gloves. So I verified that my medication is for 2 milliliters. So this is a multi-dose vial. I'm going to clean the vial because it's been opened. I'm going to pull back 2 milliliters of air and inject into the vial. And then I'm going to pull back 2 milliliters of medication. Okay. Make sure there's no bubbles in the vial. And then I'm going to make sure I've drawn up the correct amount of medication. 2 milliliters. Alright. So I'm going to gather all my supplies, go to the patient's room, explain the procedure to the patient, and then prepare the patient for injection. And I will show all the injection sites at the end of the video. So I'm choosing the vastus lateralis. It's intramuscular. So I'm going to clean from inside to out. The injection goes in at a 90-degree angle. Quick. Stabilize the needle and then inject the medicine slowly. I'm going to withdraw this, place in my sharps container, and apply pressure to the site. And that's the IM injection. The next injection that I'm going to do is subcutaneous. So this is with a different needle. And I'm going to check the physician's orders. I'm going to check the MAR, make sure that everything's correct. I'm going to check my vial, the medication, to make sure that it matches. Gather all my supplies, and I would also do hand hygiene again, gather all my supplies, and then apply my gloves. Okay. So the medication reads for 15 units of insulin. So I would draw back 15. I'm going to clean the vial with alcohol. It's a multi-dose vial. Inject the air. And then I'm going to draw back 15 units of insulin. Units. Okay. So this has a safety, so I can pull that up and lay it down. I'm going to gather all my supplies, take it to the patient's room, explain what I'm doing to the patient. And this is subcutaneous, so I can go ahead and show the sites on this. Subcutaneous is going to be the back side of the arm and the subcutaneous tissue. It can be subcutaneous fat on the back of the arm. It can be anywhere in the abdomen, 2 inches away from the navel. You can also give this in the back, the top part of the hip in the subcutaneous tissue. You can give it in the subcutaneous tissue on the hip, and also the sites up in the back where the subcutaneous tissue is underneath the scapula. So I'm going to demonstrate how to give it. You clean from inside out, applying pressure. Going to go at a 45-degree angle. Inject the medication. Draw your needle, put the safety cap in the sharps, and place pressure. Alright. The last injection that I'm going to perform is intradermal. So I'm going to attempt to use a hot dog for this demonstration. So I'm going to rid of my gloves after that injection, wash my hands. So when I prepare to do this one, I'm going to wash my hands and apply my gloves. I'm going to check the physician's orders. I'm going to check the MAR. Make sure that the order matches what's on the MAR. I'm going to check the medication as opposed to the physician's order. Multi-dose vial, so I'm going to clean the vial. This is a intradermal, so you would go in the forearm. You can also go in the back of the arm or on the inside of the arm, depending on what medication you're injecting. I'm doing a TB skin test. The order reads for 0.1. I'm going to pull back the air, inject it into the vial, and I'm going to pull back 0.1. The medication is 0.1. Okay, so I would clean the site. Gonna go with bevel up when you're doing this test. Going to inject under the skin, and then you should have a bevel when you inject the medication. And I've attempted this several times and I cannot get the hot dog to bevel up like the skin would. But normally you would have like a little bubble pop up. So this concludes my assessment of the injections. I'm going to place this in the sharps container after use. So this concludes my injection. This includes my validation of injections, and then I will do an addendum video to show the sites of the IM injections.